7:24. Time to talk about mommy makeovers, but Mommy Makeover 2.0, really. Dr. Kevin Smith of Charlotte Plastic Surgery is here with us. How are you this morning?
Doing well. Thanks for having me.
Yeah, thanks for coming in. When we say Mommy Makeover 2.0, it's sort of a new and improved version of the Mommy Makeover, right?
That's right. We've really changed the procedure now from what we used to do several years ago. Over the last 4 years, we've got a new product called Exparel, which is an injectable medicine like Novocaine that we put in at the time of surgery. And this really improves the post-operative recovery. It lasts 3 days, and we found that our patients who get the Exparel injections take 60% fewer narcotics and are up and about much more quickly. So we've shortened that recovery phase.
Because that is sort of a big part of the concern going into this type of surgery. We're talking about tummy tucks and breast lifts and things like that, because it is very, very painful.
Yeah, well, that's traditionally what people thought.
Yeah.
But now with Exparel, most of my moms who have had C-sections say that this was a lot easier than my C-section.
Oh, wow.
Because it really makes a big difference.
Let's talk about what moms are typically feeling when they come to your office and they just sort of start to broach the subject of some of these different procedures that might make them feel a little bit better after they've had their children.
Well, after pregnancy, there's a lot of changes with the body, as all women know. And, you know, women would like to fix that. They work hard in the gym, they do their hula hooping, they do everything they can to get in great shape.
Yep.
But there's just some things that you can't squish or wish away. And they come in and would like to do these procedures, but then get guilty about it. But this is really all about empowerment. When you feel better, you're more effective, and you shouldn't be guilty. This is the reward for having those kids.
Yeah, why do you think they feel guilty? Is it they feel guilty because they know how much it's going to cost to do it? Or they feel guilty because they think, well, I should just, this is the new me now, I should just live with it?
Moms are always in the family mode, and the kids are first in the families. And so that's important. So they are reluctant to do things for themselves, but they should.
What are the typical procedures that you do during what would be a mommy makeover?
Well, during pregnancy, breasts can lose volume, breasts can get droopy, so we can restore volume with augmentation. We can do lifts to put the breast back on the chest where they belong to get a little more perky than they were after pregnancy.
Yes.
Sometimes, if a patient likes their volume, then we just do a lift and it doesn't involve any implants at all. And then with tummies, the real key is getting those muscles back together, so we anatomically restore them so they can work more efficiently, and then we remove all that extra skin and can remove a lot of the stretch marks. And with the new techniques that we're using, we don't use drains anymore in most cases.
Yeah, a lot of women who've had these procedures in the past know what that's like.
And those drains are no fun.
Yeah.
And that without that encumbrance and with more comfort, this is a much easier procedure than it used to be.
What's the downtime afterwards usually for these procedures?
I tell most moms that you can do this on a Monday and be in carpool the next Monday.
Oh.
You're tired, you're fatigued, having surgery takes a lot out of you. You need help with those kids for that first week. But you're starting to resume your normal activities. You're not completely healed for 6 months. You're not back 100% to yourself for 4 to 6 months, but you're functional. You may want to take a nap with those kids after that first week, but it's not the 2 and 3 week length of time that it used to be because of that Exparel, because of the no drains, that really speeds up that recovery process.
And in the 30 seconds before we let you go, people always hear about this and think, well, that's great, but can I afford it? Where is the cost, and can you do it piece by piece, or do you have to do it all together?
No, it can certainly be done piece by piece. It's nice to be able to do 2 things together with just one anesthetic, but it can be done together. And generally, depending on the patient, depending on what's done, anywhere from $10,000 to $15,000 perhaps.
Yeah, you'd have to definitely talk to your doctor and see what you would need. And of course, the folks at Charlotte Plastic Surgery are always a great resource. Dr. Smith, thanks for coming in.
Thank you so much.
Really good to see you. Great information for all of us.